right now when we think of multidisciplinary care team, we think about the very traditional medical oncologist, radiation oncologist, and surgical oncologist. And that model works reasonably well. But the other challenge, of course, is that it's still not adopted at the vast majority of cancer programs because of limitations in terms of space to be able to have patients seen in one visit by multiple specialists, different alignments between physicians who might be in different practice situations, private versus employed, aligned with the health system versus not aligned with the health system, and geographically dispersed. So that's where we are there. So when we talk about the next generation multidisciplinary team, I think you have to, again, think of it in two ways. The first is there are a lot more folks that need to be a part of the team because things have gotten more complicated. So we've already, in addition to that core 3 providers, we've already added, navigation is very important, and so of course the navigator is typically a part of the team. Social work, nutrition, sometimes psychosocial support, pastoral support. But now we're getting into the situation where the drugs become very complex. We're no longer dealing with just cytotoxic chemotherapy, so you need a pharmacist, a clinical pharmacist often, because how do you know which mutation the patient has and then matching the right drug, targeted therapy or immunotherapy. We're also now getting into needing perhaps in some instances a geneticist or a consultation with a geneticist. And then how do we get that whole team together when they may be geographically dispersed, again, not aligned together, and what tools can we use? Because you want to be able to prospectively create a treatment plan for that patient. And, is it a virtual tumor board? Is it telehealth? Is it somehow working together with the health system as the nexus to bring non-aligned groups of providers together and being the focus for that team? So we've got to figure out how to do this because, first of all, cancer care is becoming ever more complex. We now have more and more potent tools to bring to the fore for the patient. And we really can't be providing provider-centric care. It's got to be patient-centric care, which means we have to bring the care to the patient.